And so it is my pleasure to introduce to you Dr. Leslie Weisenfeld. Leslie is a colleague of mine, a close friend. We work together at Mount Sinai Hospital, where Leslie is the Deputy Chief of Psychiatry at the University of Toronto. She is the Associate Postgraduate Director. She is an outstanding educator, clinician. She leads our Geriatric Psychiatry Consultation Liaison program at Mount Sinai Hospital. And she's going to be talking with us this evening about depression in seniors. Leslie, come on up, please.
Excellent. So you can hear me a little bit better. Hopefully that helps. I'm going to stay here with my notes for a second. I'm usually used to, as the geriatric person, coming after the child person, so I'm a little bit discombobulated, but I'm happy to go first for the first time in a long time. So thank you for having me. I'm sorry for my back to my folks over here. My apologies. Really just to echo, I think, what Danielle and others have said. Of course, this is really important to be here together, and I'm sort of struck, sorry Marshall, I'm going to go ahead. I'm sort of struck by this sort of issue of, and this sort of wonderful thing about the wisdom in the room, and I think to Danielle's point and others' point, want to use a little bit of this time together to talk about kind of work with seniors and older adults, and also to think about the kinds of things that I've learned from my patients and the families that I've been privileged to care for. In terms of thinking about depression and older adults, there's probably a few kind of key things that maybe people know, maybe they don't. One of the things that people are maybe sometimes surprised to hear is that depression isn't actually commoner as you get older. Sometimes we can make a lot of assumptions about what it's like to be older, but in fact the really good news, Olin was speaking earlier about the good news, is that many people age very well and don't have any depression as they get older. But there's a very big but, because one of the things that also happens as people get older, as I'm sure we all know as we watch our relatives and family, is that you can accrue a lot of loss, you can accrue a lot of change. And so if you're lucky enough to kind of get older with relatively good health and good supports, you may be able to kind of age into your 70s and 80s and 90s without ever really kind of having a sense of what anyone else means when they talk about depression. But if you're less lucky, if you get ill, if you get frail, if you're more isolated, if you have other kinds of problems and vulnerabilities, then your risk of depression goes up and up and up. And so I often think about how it's very important for us to not make assumptions about what an older person's experience is like, and also very important to think as we watch our older relatives or family or friends going through those kinds of losses, to think about reaching out and reaching in a little bit more so that we can try to find opportunities to help them as they age. I think the other thing that may be a little bit surprising as we think about depression, is that depression can look and feel different in an older adult. Sometimes a person who's older, and I'm not sure if this will change as the generations change, but older adults are a little bit less likely to say, I'm depressed. They're more likely to say, I feel tired, I don't really feel like doing things anymore, no, I don't want to go out, no, I don't like that anymore. And often that's kind of depression's way of kind of speaking kind of out through an older person's lens. And I don't know whether or not in sort of 30 or 40 or 50 years as psychology and Oprah and Dr. Phil and all those television shows that we've all seen, if all of us who've kind of grown up and grown older with that kind of experience, maybe people will be more likely to say they feel depressed. It's hard to know. But I think one of the things that's really important about that is we can make an assumption that if someone is feeling kind of physically unwell and say they just don't feel like doing anything, that it's just their physical self that's suffering as opposed to also their psychological self. And also, and again, this is what I learned from my patients and the families that I care for, I think the other thing that we sometimes miss is that although getting older can be a time of kind of getting a deeper sense of self and kind of consolidating what you wish in your life and what you want, it can also be a time when people feel really invisible. And certainly one of the things that I hear over and over again from older adults that I see in the hospital and in my office is they feel like they have so much wisdom, so many things that they have kind of grown to know and contribute. And as they reach a certain point in life, they're kind of at the further end of the table at the Seder, or they're further at the back of the row. and that they're given kind of only a bit of a passing glance when they have lots of advice to give. And I don't want to make assumptions. We're not all the same. Not everyone has the same experience. But this word invisible comes up over and over and over again, as I do work with older adults. So when I talk to kind of older adults, thinking with them about their experience of depression, I try to think about helping people to realize that all of the selves that they've been throughout their life, are still as important as what they are now. As many people tell us that although, when they look in the mirror, they still see the self that they were many, many, many years ago that people don't see anymore. Treatments for depression are actually relatively similar for older adults, and that's the other thing that I think is really important, because there can be this assumption that if you're depressed, maybe in the context of being bereaved or having losses or having frailty, that maybe some of the treatments for depression won't work as well. And in fact, that's just not true. Many older adults respond to the same treatments for depression as younger people, and I'm sure Marshall will speak a bit about that as well. And so I think, again, the critical message, as Mullen was saying earlier, is that it's never too late to seek help. It's never too late to see if some of the treatments, both biological and psychological, can help with depression. I remember a patient of mine saying, I can appreciate that I have to get used to getting old, but I shouldn't have to get used to getting depressed. And I think that's a really important message in terms of adaptation going forward. Of course, and I think folks earlier mentioned this a little bit. One of the things that's definitely true, and it's kind of the focus of the discussion here today, is that sometimes depression is accompanied by suicide, and sometimes it's accompanied by a lot of suicidal thoughts and a sense that life isn't worth living and that you don't have any value. And I'm sure I speak for all of the family members and professionals in the audience when I say that probably the most humbling experience we have is sitting with patients and asking them those questions about what are your thoughts and what are your plans, and do you think that you can keep yourself safe? Those are some of, frankly, the scariest and most humbling kind of conversations that we have. And I think it's very important to keep in mind that older adults unfortunately have the highest rate of suicide amongst all ages. We don't always think about that. We don't always know that. Part of the stigma, of course, around depression and suicide is often suicides are hidden in the elderly. There's a lot of kind of taboo, of course, and a lot of covering and people feeling embarrassed, which is part of why we're here today. So we can't make assumptions that an older adult is immune from suicidal thoughts, and often need to kind of think about how to reach out and how to give them opportunities to seek care going forward. And I say that not to invalidate the feelings that people have of whether or not life is actually worth living at various stages of life, but to recognize that having thoughts of diminished value and diminished kind of quality of life are often feelings that can be improved with either medication treatments, psychological treatments, and to some degree, empathic connection. Certainly one of the things that I continue to be struck by in terms of my care of patients is sometimes we can't help the frailty, we can't help the physical burden, we can't help the loss, the sense of feeling disconnected from family, but having a kind of bearing of witness to that experience as someone is growing older can often be a really important contribution. And it's not a contribution that is uniquely made by professionals, of course. To paying attention, listening to stories, asking someone who's older for advice, what would you have done if this was your problem at work, recognizing the kind of experience that an older person has to bring is quite important as well. I was thinking about also the issue of hope, because I think one of the things that depression takes away, I sort of think about depression as being the opposite of rose-colored glasses. It makes everything seem bleak, it makes everything seem negative, and it's really tricky to think about how to give advice, even to families who sometimes ask me, what should I do with my dad? He seems really depressed. We want to be encouraging. And it's tricky, because I think the other thing that I feel is important to share as we think about stigma is there's also stigma about, I think, living with depression. And many people with depression, especially older adults, but I'm sure it's not unique to them, is the feeling that when people try to be encouraging, it can feel actually invalidating. When people say to you, just try harder. When we don't tell people with diabetes to just try harder to get their blood sugar down, we recognize that that's a bit beyond their control. And we don't ask people with broken legs to run. We try to support them while they get rehabilitation and get their muscles in good shape. And so we all need to kind of find ways, and we need to practice reaching out to older adults with depression in a way that isn't about just try harder, go to that bridge game, go on a trip, but to recognize that it must feel really, really hard to be suffering a lot of the time, and to give people support and be able to say, I know you're suffering, I know you're sad when you don't want to feel sad, please tell me what would make you feel better. Should I keep inviting you out for tea, or do you need a break? And I think those are the things that we all have to learn and we all have to practice in terms of making sure that people with depression don't feel an extra burden as if they themselves are supposed to solve their own problems. I don't want to take up too much of the time because I want to make sure there's time for questions, but I just want to sort of echo what Dr. Lesh was saying about it never being kind of too late to seek treatment, sharing a little bit of a story that a family member shared with me. There was a wonderful, exemplary son who had cared for his mom in many, many different ways and had brought her for the first time to see a psychiatrist in her early 80s when I first met her. She was actually very lucky. She'd had depression for quite a while, but responded beautifully to the very first medication treatment and then stayed well for about another decade after that. And every single time that he came to my office for a checkup, he would say to me, I can't believe I waited all these years. I thought she was just in a bad mood. I can't believe it was depression. And so, it was this kind of sad, beautiful moment of someone recognizing that despite all of their care, they had sort of thought something was one thing when it was actually something else. And so it's hard to know. It takes a lot of training and experience to kind of figure out whether someone is suffering from anxiety or depression or is demoralized or is bereaved. But I think the main message of coming together is that people don't have to suffer. They don't have to suffer alone for sure. And so I would encourage people, and I'm sure we'll talk more in the rest of the evening, about how to make sure that if you are suffering, if you see someone who looks like they used to enjoy being with family, being together, and now they look withdrawn, now they look sad, then reach out to that person and say, look, I think you might be depressed. Why don't I see if I can help you get some help going forward? So thank you for having me. Thank you, Danielle, for your words as well. And I look forward to answering questions later. Thank you.